your examination today. How are you feeling?
Good.
Good. All right, so we're going to start off with just some questions, and then we'll get into the actual examination part, okay? So what are you here for today?
Just a checkup.
And do you get yearly checkups?
Yeah.
Yeah. And how would you say that your general state of health is?
Good.
Good. And are you experiencing any chronic or acute medical problems?
Nope.
No. Okay. And have you ever had any significant illnesses in the past?
No.
No. Have you ever had any surgeries?
No.
No. Have you ever been in the hospital for any reason?
No.
No. Have you ever had any trauma or injuries?
I herniated in my back once.
Do you know what part?
L5, that's fine.
Do you still have any symptoms from that? Any pain, difficulty with anything?
Sometimes pain down my left leg.
Does it keep you from doing any activities?
Nope.
Have you had all of your childhood immunizations?
Yep.
And do you get a flu shot every year?
Yep.
Have you had your COVID vaccination?
Yep.
And do you take any medications every day?
Nope.
No? Do you take anything over the counter as needed?
Nope.
Okay, and do you take any herbal remedies?
No.
No. Do you have any allergies to any drugs?
No.
No. Do you have any seasonal allergies?
No.
And are you allergic to any foods?
No.
Alrighty, and you said that you see a physician regularly. Do you also go to the dermatologist?
No, but
And do you have any family medical history?
both my parents had cancer, and
What kind of cancer?
my dad had colon cancer and my mother had breast cancer.
Do you know what years or how old they were when that occurred?
My mom was 52 and my dad was 62.
Okay, and are they both still living?
Yep.
Do they have any other chronic conditions?
My mom has rheumatoid arthritis.
And your father? And do you have any siblings?
I have one.
Do they have any chronic medical conditions?
No. Or yeah, he has sleep apnea.
Sleep apnea. And what about your grandparents? Are they still living?
My grandma is.
On your mom or dad's side?
Mom's side.
Does she have any chronic conditions?
She has COPD.
And then your mother's father, what did he pass of?
Cancer.
Do you know what kind?
I don't know.
And then your dad's parents, they're neither of them are living?
Correct.
Okay. And do you know what they passed of?
I do not.
Okay. And do you work?
I'm in school currently.
You're in school? What are you in school for?
Physical therapy.
And do you have a good relationship with your family? And what do you like to do for fun?
Go basketball, go hiking, go run out there for a marathon.
Oh, nice. That's awesome. Are you religious?
Yes.
Do you belong to a church?
Yes.
What church do you belong to?
St. Charles.
And besides school, do you have any stress factors in your life?
Besides what?
Besides school?
No.
No. Do you have a good support system outside of your family, friends?
Yep.
Do you smoke?
Nope.
No. Have you ever smoked?
No.
Do you drink alcohol?
Yes.
How much would you say you drink per week?
I don't know, 3 years.
Okay. Do you ever use recreational drugs? Are you ever around any environmental risks like asbestos or anything like that? No. And you said you like to hike and play basketball. Do you have a healthy diet?
Yep.
And have you had any recent travel outside of the country?
No.
No. Are you sexually active?
No.
Have you ever been?
No.
And do you feel safe in your home?
Yes.
Have you ever been a victim of domestic violence?
No.
Alright. Have you noticed any weight changes? No. Have you had a change in your appetite recently?
No.
No. How many hours of sleep do you get a night?
About 7.
And would you say you ever have any sleep disturbances?
Nope.
No. Do you ever have night sweats?
Nope.
Have you been experiencing a fever,
I have not.
chills,
Nope.
malaise, fatigue?
No.
Have you noticed any changes to any moles on your skin?
No.
Have you had any abnormal hair growth or hair loss?
Nope.
Have you noticed any new rashes or lesions on your skin? What about any itching?
I don't believe so.
Have you had a history of a head injury?
No.
Okay. Have you ever experienced dizziness?
No.
Okay. Do you experience headaches?
Sometimes.
Are those caused due to anything that you've noticed?
No, but it's dehydration.
Okay, so do you take anything for it, or do you just drink water?
Just water.
And do you wear glasses or contacts?
Nope.
When was your last eye exam?
3 years ago.
Okay. Have you noticed any changes in your vision?
Nope.
Have you experienced any double vision,
Nope.
blurriness, any discomfort or abnormal discharge?
Nope.
Have you experienced any hearing loss?
No.
No. Do you have any abnormal discharge from your ears or any pain?
Nope.
No. Do you ever experience any ringing in your ears
No.
or a type of dizziness called vertigo?
Nope.
No. Are you having any congestion in your nose or sinuses?
No.
No. Do you ever experience nosebleeds?
No.
Do you ever experience hoarseness in the back of your throat?
No.
Sore throat?
Sick.
When you get sick? Okay. Do you see a dentist regularly?
Yep.
When was your last dental appointment?
January.
January. And do you have any problems with your teeth? Any cavities, breakages, loose teeth?
I've had one cavity.
Was that recent or?
3 years ago.
Have you noticed any lumps on your neck?
Nope.
Do you have any pain with neck movement?
Nope.
Have you noticed any lumps or pain in your chest?
Nope.
No. Have you ever had any discharge from your breasts?
No.
Do you experience a cough or do you cough anything up? No. Have you ever had any bloody sputum? No. Do you ever get short of breath while you're going upstairs?
No.
What about when you're laying down flat?
No.
How long would you say you can exercise before you get fatigued?
I can run about 18 miles.
Do you ever have any chest pain?
No.
Have you ever experienced a palpitation? It kind of feels like your heart's racing really fast. No. You said you follow a good diet. Have you ever noticed any changes in your stool lately?
No.
No. Have you ever had any bloody stool?
No.
Have you ever vomited up blood?
Nope.
Have you do you experience any abdominal pain?
I do not.
Have you ever had gastric ulcers?
No.
No. Have you noticed any changes to your voiding habits?
No.
No. Have you ever noticed any bloody urine?
Nope.
No. Do you have any pain with urination?
Nope.
Have you ever been told that you have an enlarged prostate
I'm not.
or have a prostate infection?
I'm not.
Have you noticed any abnormal discharge?
Nope.
No. Have you ever had any seizures?
I have not.
No. Do you have any numbness or tingling in your hands or feet?
No.
No. And you said the pain in your back, that's just pain, it's not like numb down your leg at all?
I have numbness down my legs sometimes.
And which side is that?
Left side.
And, you said you have back pain, do you have pain in any of your other joints?
My ankle sometimes.
Do you have a history of an injury to that ankle?
Broke my ankle both times.
Would it be your right or your left?
Both.
Have you noticed any stiffness in those ankles or any of your other joints?
Yeah, my ankles are stiff.
Have you noticed any recent inflammation or redness in either of those joints? No. Have you ever been told that you're anemic?
I don't.
No. Do you bruise or bleed easily?
I don't.
Have you ever had a blood transfusion?
I have not.
No. Have you noticed any excessive thirst or urination lately? No. Do you have a hot and cold intolerance?
No.
No. Have you ever sought treatment for any psychiatric disorders?
Nope.
Do you ever experience mood swings?
Nope.
Do you ever have delusions or hallucinations?
Nope.
And are you currently experiencing any suicidal thoughts?
Nope.
Have you ever experienced suicidal thoughts?
Nope.
Alrighty. So we're gonna get started with your exam now, and it's gonna be a head to toe exam. So I'm gonna look at your head, your face, your chest, your stomach, and then your legs as well. Is that okay with you today?
Yeah.
I'm gonna start off with your head here. Just gonna feel around. Do you have any tenderness here?
Nope.
Okay. I don't feel any lumps or see any lesions, and it looks like your hair is well distributed. All right. Can you look at me? Your face looks symmetrical. Can you smile for me? Good. And frown. Can you puff your cheeks out for me? Raise your eyebrows, and then scrunch your eyes really tight. Done. I'm just gonna feel on your forehead here. And I'm gonna take a listen.
All right.
So those are regular rhythm. Okay, and then I am going to touch your face with this cotton ball, and then we're going to use this pen. Can I see your finger? Okay, so this is the sharp end, and then this is the dull end. So I want you to tell me when. First, we're going to do where you're going to tell me right or left what side you feel the cotton ball on, and then you're going to tell me if the sensation is dull or sharp.
Okay.
Does that sound good? All right, will you close your eyes for me?
Left. Left. Right.
Okay, so now I'm going to use the pen cap, okay?
Okay. Sharp. Dull. Sharp. Sharp. Dull. Dull.
Alright, so now I'm going to take a look at your eyes. So this is my eye chart. I'm going to stand back here. I want you to read the smallest line that you can see. Can you cover that eye for me?
L T F P H.
Good. And then can you cover your other eye? And then can you read the same line backwards?
H P F T L.
Very good. And then I'm just going to take a look at your eyes here. Okay, it looks like there's no swelling or drainage, no redness. Touch your eye here. Your eye will come home. Okay, the conjunctiva is clear, pink, no redness, no swelling. The sclera is white. And then will you close your eyes for me? And then that's firm, which is good. And then I'm going to take a look at your pupils here. So just look straight ahead, okay? Pupils are equally round and reactive to light. Okay, and then I want you to follow my fingers, okay? But just your eyes, good. And then I'm just gonna take a look in your eyes. So I want you to just look straight forward, okay? ears here. Do you have any pain or tenderness?
Nope.
Firm. Inside here. Tympanic membrane is pearly and intact. Move forward for me. Same on both sides there. Alrighty, so I'm gonna stand behind you and I'm gonna whisper 3 numbers and I want you to repeat them back to me, okay? And can you cover one ear for me?
752.
Alright, and we'll do the other side.
814.
Alright, so I'm gonna do a couple more hearing tests. This is my tuning fork, and I'm gonna make it ring and sit it on the top of your head, and I want you to tell me if you hear it one side more than the other or equally.
Okay. Alright.
And now I'm going to do the same thing, and I'm gonna put it behind your ear right here,
Okay.
and I want you to tell me when you can't feel the vibration anymore, and then I'm gonna move it in front of your ear here, and I want you to tell me when you can't hear the sound anymore.
Okay.
Sound good?
Yep. Okay. Okay.
And we're gonna do it on the other side.
Okay. Okay.
Alrighty, and we want that second sound to be twice as long as the first sound, which is one, so that's good. So next, I'm gonna look up your nose here. Look at your septum. Any pain or drainage coming from your nose?
Nope.
So that looks like your septum is midline. And I'm gonna take a look in your mouth. Can you open your mouth for me? Good. Everything looks pink and moist. I'm just gonna look in the back here for you. Look white and straight, and then I'm gonna put this on your tongue, and then I want you to say ah, okay? Alrighty, and then I'm gonna touch your jaw, and I want you to clench really tight for me. Good, and then open your mouth. Alrighty, so now we're gonna move on to your neck here, and I'm gonna move your gown down just a little bit. Looks like your trachea is midline. Feel here. Okay, and then I'm gonna feel your lymph nodes, okay?
Okay.
So this is the ocular lymph nodes, or I'm sorry, the occipital lymph nodes, post-auricular, preauricular, submandibular, submental, tonsillar, supraclavicular, or no, these are the supraclavicular, superficial, cervical, deep cervical, and posterior cervical. And I can't feel any of those, so that's good. And then I'm going to feel for your carotid pulse here. +2 regular rhythm. And then I'm going to take a listen. then I'm gonna assess your thyroid. So I'm gonna stand behind you. I'm gonna move your trachea out of the way, and then when I tell you to, I want you to swallow. Okay? Can you swallow for me? Good. Stand on the other side. Can you swallow for me? Alrighty. Alright, so next I am going to move on to your respiratory assessment. So I'm just gonna take a look at your back here while you're breathing, then move to your front, okay? Alright, so just breathe normally for me. So everything looks symmetrical. And then I'm gonna place my hands back here and I want you to take a deep breath for me, okay? Good. One more. Good. So, and that was that was symmetrical as well. So I'm just feeling back here for any lumps or nodules or any crepitus, which you don't have. And then I'm gonna place my hands on your back and I want you to say the number 99 as I move my hands down your back.
99, 99, 99.
Good, and we wanna see that decreased vibration as I move your hands down my back. So now I'm going to tap on your back, so just breathe normally, okay? Good, so we hear that dullness over your rib cage bones. Alrighty, so I'm gonna take a listen to you. Take a big deep breath every time I move my stethoscope, okay?
Alright.
Good, and you hear those vesicular sounds throughout on your back. So I'm gonna ask you to take your gown off so I can do the same thing on your front. Alrighty, so I'm just gonna take a look while you breathe normally here. Alright, now I'm gonna place my fingers here, take a big deep breath for me. Good, so it's symmetrical there. I'm gonna do the same thing, I'm just gonna feel around for any lumps or nodules or any crepitus. Good. And then I'm gonna do the same thing, I want you to say the number 99, okay?
99, 99, 99.
Good. And then I'm gonna be tapping on your front, okay? And then I'm gonna do it on your side here. I'm gonna take a listen to you. You hear those bronchial sounds up there. Hear the bronchial vesicular sounds. And then vesicular sounds. Are you okay, or you need to stop? Because I know we've been deep breathing a lot.
Oh, fine.
You're good? Okay, so I'm gonna listen to your sides as well, so if you could hold this arm up for me. Good, deep breath. Good. the diameter is about 9 or so inches, which is good. So now I'm gonna have you lay down, and we're gonna do your heart assessment here. Turn your finger side for me, thank you. So I'm just looking for the point of maximal impulse, which I don't see while I'm just standing here. I'm gonna feel your chest, okay? That's the point of maximum impulse. Can you turn your head to that side for me? Just gonna feel on your pulse here, make sure that they match. Which they do. And I'm just gonna take a look at your neck. Keep facing that way for me. Okay, looks good. I'm just looking for your vein distension in your neck, which I don't see. Can you look that way for me? Alright, very good. And while you're laying down, I'm gonna listen to your heart here, okay? This is the aortic valve, pulmonic valve, the mitral valve, and the tricuspid valve. Okay, could you lay on your left side for me? Take a listen again. And then could you sit up for me? Alright, take a listen one last time. Alright, very good. If you'll lay back down, I'm gonna do your abdomen exam now. So just breathe normally for me, and everything looks symmetrical here. Okay, and I'm actually gonna listen first. That sounds right in all 4 quadrants. I'm gonna take a listen to your liver here. And your aorta. And your spleen. Okay. So I don't hear any vesicular sounds in your liver or your spleen, and your aorta sounds regular. I'm gonna listen to your renal arteries as well. Alright, so I'm just gonna feel around on your stomach, okay? Let me know if you have any tenderness, alright? Have any tenderness there? Okay, can you bend your knees up for me? Okay, and then I'm gonna press a little harder, okay? Do you have any tenderness with this?
Nope.
Alright, and then I'm just gonna feel for your liver here. Feel smooth. And then I'm gonna feel for your spleen here. I'm gonna put my hand underneath it here. Okay, and I can't feel your spleen, so that's good. And then I'm gonna feel for your aorta here. And then you can straighten your legs for me. And I'm just gonna feel your femoral pulse here. Regular +2. On your side. Regular +2. You can go ahead and put your gown on and sit up for me. We're gonna start with your arms here. I'm gonna look at your fingers. Cap refill is less than 2 seconds on each side. Flip your hands over for me. Everything looks good there. And then so we're gonna do some range of motion stuff. So can you spread your fingers out for me? Good. And can you touch each finger to your thumb? Good. And can you put your fingers all the way down? And then up this way. Good. And then your wrists all the way down. And then your wrists all the way up. And then can you extend your arms for me? And touch your shoulders. Good. And can you extend your arms again for me and put them out in front of you? And swing all the way back. Good. And then all the way up towards your head. Good. And can you put your arms out to the side for me? And can you swing one over in front of you? Good. And now the other side. Good. And now can you put your hands behind your head? Good. And then behind your back like this. Perfect. Alright, so I'm going to just feel your pulses here. So your radial pulse +2. Radial pulse +2. Ulnar pulse +2. Same on the other side. Straighten your arm a little bit more. Brachial pulse +2. Brachial pulse +2 again. Alright, so we're gonna do some strength exercises. So we're gonna do one hand at a time. And I'm gonna push up on your fingers and don't let me push them up, okay? Good. Now the opposite. Up. Good. And we're gonna do the same thing with your wrists, okay? So push down. Good. And now I'm gonna push up. Good. And then we're gonna do the same thing with your elbow here. Push down. And then I'm gonna test your reflexes here. We're gonna start off with the tricep on the back here. And then we're gonna do your bicep one here. And then your brachioradialis. Alright, and then you're going to do your spine. So if you would stand up for me and then turn that way. Just gonna take a look at your spine here. Everything looks symmetrical. Can you bend over for me? Touch your toes. Good. I'm just gonna feel your spine here. I'm tie this for you. Alright, you can bend over. Just gonna feel your spine here. And your muscles are symmetrical here. You can back up just a little bit. Alright, can you bend over all the way and touch your toes?
I can't as well.
Okay, alright. Can you bend over as far as you can? And then straighten back up. Alright, you can go ahead and sit back down. And then, alright, we're gonna move to your lower extremity. So can you take your shoes off for me? And then I'm gonna remove your socks here. Alright, so I'm gonna start off with feeling your pulses. Dorsalis pedis. Posterior tibial. Both +2. Feel this one behind your knee, papa 2. Very good. So we're gonna do some more range of motion. We're gonna start with your toes. Can you curl your toes all the way under and then up as far as you can? Good. And then for your ankles, can you flex them up and then straighten them out? Good. And then can you move them in and out? And then if you'll lay on your back, we'll do your hips. And can you put your legs straight for me? Good. Can you raise your right one up all the way? Good. You can let it back down. And then can you put your knee to your chest with your right leg? Good. And now we'll do the other side. Okay. Is that the leg that you have pain in from your back?
Yep.
Yeah. Okay. And then knee to your chest. Good. And then can you bend your knee for me? Oh, put your foot on the table. Yep, just one at a time. And then can you let this knee fall in? So put this out just a little bit. Yep, and then fall in towards the midline. Okay. And then can you do the other side? Good. And then can you take this foot and put it over your leg on the opposite side, and then can you have your knee fall out? Good. We'll do the other side. Good. And then can you have that right leg swing out to the side, straight? Yep. And then back over, over top of your other leg, actually. Good. And then this one out to the side all the way. Good. And then over top that other leg. Good. All right. And then I'll have you flip over on your stomach. We'll do one more. And then can you lift up your right leg? Keep it straight for me. Can you straighten this out for me? And keep it straight when you lift it up. Good. And now the other side. Perfect. All right, you can go ahead and turn back over and sit up for me. Alrighty, so we're gonna do some more strength. So on your toes, I'm gonna push up and push down. Good. And then the other way. Good. And push down. And push up. Alright, so we're gonna do your ankles here. So I'm gonna push down. Good. Good. And push down. Okay. And I'm gonna pull out towards me. Push in. Very good. Alrighty, so we're gonna do some sensation tests. We're gonna do the same thing with the cotton ball to start your shin. Good. And now the other side. Very good. And can you place your hands like this on your lap? And then turn them over slowly. And then a little faster. And then as fast as you can. And then if you lay down for me, I'm going to touch your feet with this. Okay. You, straighten your legs for me. And I want you to tell me if you can feel it, alright?
Yes. 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 Yes.
Okay, and the other side.
Yes. 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 Yes.
Alright, so if you'll stand up for me, we'll finish off with some walking and then finish up your range of motion. So, will you go like this for me, lean to one side? Good. I'm gonna look at your back here while you do this. Okay, and then the other side. Good. And then can you put your arms up and arch your back backwards towards me? Good. And then if you come out a little bit, turn this way for me. And then I'm gonna hold your hips steady and I want you to rotate your back for me. Good. Alright, and then I'm gonna look at your gait. Are you able to walk about 7 steps that way for me? Okay. Alrighty, and then can you walk there on your toes and back on your heels? Good. Alright, and then one last time, can you walk heel to toe from there back? So on your way back, I want you to put your heel to your toe and walk like this. And then are you able to stand still and